How are schwannoma symptoms distinguished from other conditions? Imagine feeling a lump or experiencing nerve-related sensations that seem to come out of nowhere. That's often how schwannomas first present. These benign tumors develop from Schwann cells, which insulate nerves, and their symptoms usually depend on where they grow and how big they get. Because they grow slowly, their signs can be subtle and often mimic other health issues, making diagnosis a bit tricky. One of the key ways to tell a schwannoma apart from other conditions is by the pattern of symptoms. Many people notice a lump that feels painless or only mildly tender. This lump is usually along the path of a nerve and can sometimes be seen or felt under the skin, especially in limbs. Unlike other tumors, schwannomas tend to grow gradually, so the lump often gets larger over months or years without causing systemic illness like fever or weight loss. Nerve symptoms are also a big clue. Because schwannomas arise from nerve sheaths, they can cause tingling, numbness, or burning sensations in the area served by the affected nerve. Weakness can also develop if the tumor presses on nerve fibers. These nerve-specific symptoms help distinguish schwannomas from other issues like muscle strains or joint problems, which usually don't involve nerve sensations. Certain types of schwannomas affect specific nerves, giving rise to characteristic symptoms. For example, vestibular schwannomas, also called acoustic neuromas, develop on the nerve responsible for hearing and balance. They often cause hearing loss on one side, ringing in the ears, and balance problems. Sometimes facial weakness occurs because of the tumor's proximity to facial nerves. These symptoms are different from other causes of hearing issues or dizziness because they tend to be one-sided and worsen gradually. To differentiate schwannomas from other conditions like herniated discs or peripheral nerve injuries, doctors relying on a combination of tools. A detailed medical history and neurological exam help identify how symptoms started and which nerves are involved. Magnetic resonance imaging scans are the gold standard. They provide detailed images of nerves and surrounding tissues, revealing the tumor's size and location. Computed tomography scans can also be useful, especially if MRI isn't available. Electrophysiological tests, such as nerve conduction studies and electromyography, can evaluate nerve function and help distinguish nerve compression from other nerve problems. If imaging results are unclear, a biopsy may be performed to analyze tissue under a microscope. This confirms whether the tumor is a schwannoma by identifying Schwann cells and their characteristic features. In summary, schwannoma symptoms are distinguished by their nerve-specific signs, slow progression, and characteristic imaging features. The presence of a painless or mildly painful lump along a nerve's path, combined with nerve-related sensations like tingling or weakness, points toward a schwannoma. Proper diagnosis involves a careful clinical exam, advanced imaging, and sometimes tissue analysis. Recognizing these signs early helps ensure appropriate treatment and the best chance to preserve nerve function. Always consult a healthcare professional for personalized advice if you notice any of these symptoms.